Now, for interactions, again, if you know the pharmacology, it's pretty straightforward. Antihistamines will be additive with the first gen because, well, antihistamine plus antihistamine, more sedation, right? Or antimuscarinic plus antimuscarinic, more antimuscarinic. So if you get the pharmacology, this is where it can really come in handy. I don't need to memorize every single interaction there is to know that there's a possible interaction because I know the pharmacology of these two drugs. Yeah. Something to just keep in mind, probably, due to pH stuff, it may decrease the absorption of chlorpromazine. CYP, self-explanatory, right? Hopefully you're used to that by now. What happens when you pair an inhibitor with a substrate, an inducer with a substrate, okay? You will see SSRIs flagged in interactions, but SSRIs and so-called antipsychotics are a common combination. So like I said, I have been on said combination in the past. So the so-called antipsychotics can be used as, particularly second and third gen, can be used as augmenting agents. So it's actually a common thing. And this will be better explained when we get to second and third gen antipsychotics. Why there is a risk of psychomotor impairment. What is it with serotonin and motor movement? We'll talk about that in a bit because there's a lot. Okay, the lithium interaction is mainly haloperidol. For some reason, there is a increased risk of enKElopathic. It's not encepha, by the way. So it's encephalitis and enKElopathy. So this one is not it is more kinetic, the nitroglycerin bit. Because if you have a dry mouth, how will the sublingual tablet dissolve under your tongue, right? So stuff like that. Again, familiarity with the pharmacology is very helpful. This one here, I gotta give some context though, the Topiramate one. The Topiramate one, why is there an increased risk of hyperthermia? First of all, you have the so-called antipsychotics. These are antimuscarinic agents. So, they block the muscarinic receptors in the sweat glands, so dry skin. No secretion of sweat. Sweat is very important for regulating body temperature. If you don't release that sweat, you get hot. Like really hot. Body temperature is gonna go up. Very important to sweat, right? What does Topiramate do? Topiramate, you see, besides being a CNS ion channel blocker, that's the pharmacologic term I use, although technically we call it anti-epileptic, fine. But MOA-wise, as a CNS ion channel blocker, besides blocking ion channels, actually, in the brain, Topiramate also happens to be a carbonic anhydrase inhibitor. And carbonic anhydrase, it's not just a kidney thing. Carbonic anhydrase can be found in many places, like the eyes, and apparently in sweat glands. And apparently, carbonic anhydrase can contribute to production of sweat. So one theory is that Topiramate may block sweat production by blocking carbonic anhydrase. So, blocking sweat production plus blocking sweat release equals hyperthermia, body temperature elevation, because you're unable to sweat out all of that body heat. Right? So, just some context there. And once again, I will never stop talking about this. False positives, false positives, false positives. Urine drug tests are one of the worst rapid tests. So, for context, urine drug tests are rapid immunoassays, similar to COVID test kits. You have antibodies that bind the molecules that will pass through them. So they're in theory supposed to be specific to, well, illicit drugs, for instance. But they're not like monoclonal antibodies. Otherwise, they wouldn't be. If they were monoclonal antibodies, they would be super expensive, but they're not. So these antibodies can often flag molecules that look similar enough in chemical structure. And some of these include chlorpromazine. Yeah, self-explanatory. So generally, rapid urine drug tests are pretty bad. Generally, confirmatory tests for these involve liquid chromatography or gas chromatography. A positive test on urine drug screens does not tell you anything. Unless maybe it's cocaine. Cocaine is the only thing that is specific in general. Unless you're taking the coca plant itself, you are not expected to test false positive there. But if it's not cocaine, the rapid drug test is not going to tell you anything. Really. Just confirmatory is the way to go. Really.